Hi, welcome. This is the monthly walkthrough sessions for live editing, and basically on how we improve medicine-related manuscripts. My name is Oindula. I represent Editage. We will talk about Editage a little bit. So Editage is basically an author services firm. We have presence all over the world, and it basically aims at, and is quite successful at bridging the gap between geographical locations from where our authors originate from, and uh, the international academia publishing world. So we try and remove this language related barrier that exists, wherein authors whose native language is not English, they feel comfortable coming to us asking for taking up our services and then going on to publish their research in international journals, very reputed journals, and then um, basically gaining the publicity and the visibility that they deserve and that their research deserves. So this is what EdTouch does, and I am an assistant managing editor um, with the medicine one and the neuroscience and neurology teams. My background is in tech basically. So I did my bachelor's in technology and then master's in technology from in biotechnology, and then my master's was in cancer and developmental biology. It was more research based, and I have now been at Cactus for a little more than 4 years, so like 4.4 months, 4.4 years or something, and I've been loving every second of it. I started as a full-time editor, a reviewer, and now I manage operations and quality for my teams, which are medicine and neuroscience and technology. So this is just a little bit about me and Cactus. Let us move on to what I think are like the five most important pillars of when it comes to writing, editing, or publishing research. So these are necessary, sufficient, precise, effective, and clear. Now, throughout our talk today, while we go through the manuscript that we will be discussing today, I will be bringing these terms up quite frequently, which is, and you will see real time examples of how each of these pillars are applied to a research manuscript and how you can keep these pillars in mind as a checklist, and they will guide you or like kind of give you a direction as to how your research should be uh, elucidated in words, right? So necessary. Um, Oftentimes we kind of say a lot of words, but then we skip out on the most necessary information. For example, in the manuscript that you are going to see today, the author has it, my biggest problems with the current manuscript is it's how the author has presented the method section, and in that they have talked about, they have put you'll see, but in the first paragraph they have put in so many words which together make very little sense, a convey very little useful information, and then skip out on a lot of necessary information. So like so they are basically describing how they selected patients for a certain study, and they completely skip out on the exclusion and the inclusion criterias. So this is what is necessary, However, this information was necessary. These the inclusion and exclusion criteria were necessary. However, they are missing in the current manuscript, right? Now, sufficient. Um, so again, picking up an example from the manuscript that we're going to talk about, um, in in terms of sufficiency, um, the first paragraph of the introduction you will see talks about the prevalence of a disease in two random countries. So they talk about the prevalence of the disease in question in France and in the United States. However, they do not talk about the prevalence, the overall or the worldwide prevalence of the disease, which would have been more relevant to or more useful in terms of conveying the prevalence or like the general idea of how prevalent this disease is in the world. Especially considering that it's the first paragraph of the introduction and you're just setting up stage to go into like dive in a little bit deeper into the subject. So in this scenario, just discussing the prevalence of the disease in the world would have been sufficient. However, they've given us data about France and United States without giving us a perspective of uh, why we were randomly discussing these two countries. So that is how sufficiency is decided and comes into picture while writing research. Precise. Now, science in general is all about precision. So you have to be exact. It has to be accurate. Your wording cannot be um, cancer is the prevalence of cancer was about this much in about these many patients in about 5 countries. That doesn't, like, a sentence like that conveys very little information and is very vague, especially when it comes to scientific writing. So it needs to be precise, and all journals have like a set of the number of they mention the number of decimal places that you can describe data in. So use it is always advisable to use that leeway. So always, if they say up to 2 decimal places, always say 15.09 or whatever the data is, 15.09%, the prevalence is this much, exact to two decimal places in these many people in exactly these many countries, or in this part of the world. It has to be precise. You cannot use words like about, approximately, very um, easily in research, or the conveying of research. Then effective. Now, regarding effectiveness, um, you could have a lot of sentences. So, for example, we're talking about concluding section, right? Now, you could have a lot of sentences in the concluding section, and all of them convey the same message. They are trying to drive the message towards the conclusion of what the research, the study just showed in the first sections. However, there will be this one sentence that is in itself completely effective at conveying the said message. So you wouldn't need the other fluff sentences to drive the message home. So, always looking for that effectiveness is always important. So, that will not only help you reduce the number of words that you're using to convey a message, but it'll also help drive the message home better, because our human brain tends to, in general, tends to uh, latch on to one message, or try and retain less amount of information. So it is always best to decide which sentence or what phrasing of information will be the most effective in conveying the take home message when writing a concluding section, and then writing just that instead of adding a lot of fluff here and there, and then clear. Now this is one of the basic requirements from an editor, basically, or our editing services. What we do is provide clarity to the sentences. We edit the sentences, we revise the phrasing, and we use different words, and help make what is being conveyed clear. So clarity mostly is very language dependent. It Like a sentence can be ambiguous, could be very clear, and this is where this is one of our basic requirements from how like from editing services, right? So so these are the five pillars of editing, and we will kind of use these pillars to build on what we're going to discuss next and that is the manuscript which has been edited. Okay, I will switch to the manuscript. Let me know if you can see my manuscript. Okay, now you will. Oh, so this is an accepted manuscript. It's not an accepted, sorry, published manuscript. So don't be bothered about like the amount of changes that I've made to this manuscript, because when we go through it, you'll understand why it was necessary. This manuscript had a lot of problems, and we're only going to discuss the abstract, the introduction, and the method section, because I think we cover most of what I want to discuss in terms of editing within these sections, and in the interest of time, it was just too much to unpack. I You will also note that I've made some structural changes as well, apart from language related changes. So I've added like this bit of information from the main manuscript text, and this has been done. Like I've deleted this entire chunk of text. I will explain to you the rationale behind why this was necessary, and we'll go through all of that. However, I have also kept this section, so the text highlighted in yellow and the associated comment. This is a section that needs rearranging. I will explain why this would be necessary, and we will rearrange this live right here while we go through the manuscript. So basically, you'll see me rearrange the text and delete unnecessary text if necessary, um, and see how it's done. So this is the manuscript that we are discussing today. This is a published manuscript. I've already mentioned that before. I'm just showing it to you because I think you couldn't see it earlier. I'll switch to original view. This is the original manuscript that has been published already, and this is what it looks like after having been edited. And so we are going to take you through the abstract, the introduction, and the method section, like I mentioned before. Um, the these kind of covered everything that I want to cover for our session today. You will see that there are structural changes, as I mentioned before. This piece of text has been added. This chunk of text has been deleted. So these structural changes I've already made. I will explain to you why they were necessary and all that. However, I've also kept this part of text untouched in terms of structural changes. There are issues, and I will explain why we need structural changes here. Like, why do we need like rearranging the text? But I've kept this so that we can do it live during the session, and you'll see how I move text around, and like how I switch from track changes, from non-track changes, and basically uh, move text around without disturbing any of the major content. And So this is how we start. Like I said, this is the rationale. The first section of the abstract is rationale. Um, and I will switch to the original text so that you can read the text. Many studies have evaluated the impact of eczema according to the established severity. However, the specific impact of the location of eczema on the quality of life has not been assessed. So this was the original text. Now, like I said before, my problem with this was that this does not convey the rationale for the study, really. It just tells you what the gap in literature was. Let me go back. See, it just tells you that a lot of studies have studied something, and however, there are no studies that have investigated something else. Now, this only establishes a gap in research. This doesn't uh, quite show you what the rationale of conducting the study was. Like, why are we studying this? Why do we need to invest time, energy, effort into studying this? So, in order to add like a bit of context to the whole uh, the abstract, I added this piece of text from the main text. So I think I picked it up from the introduction section, I believe. Yeah. So I added this. Atopic dermatitis, which is the disease being discussed in the study in adults, can cause major skin lesions and thus lead to discomfort, loss of confidence, withdrawal, social isolation, and difficulty finding a job, and thereby can have a strongly negative impact on quality of life. So, this is kind of setting stage for how AD is related to a negative impact on quality of life. Then we can go on to say that many studies have evaluated the impact of AD according to its severity. However, none of the previous studies investigated how AD affects quality of life in this patient subset, right? So now we have a picture to go on, like why we are studying this. Okay. Now, the other issue that you will note very frequently and a related change that you will note frequently in this portion of text that we are going to discuss today, is that the author used eczema, atopic dermatitis, and dermatosis interchangeably throughout the entire text. So there is no clear distinction as to where what needs to be, which term is supposed to be used where, and there's also no clear indication as to whether this inconsistency is intentional or if the author was just using it interchangeably while thinking that they meant the same thing. So I have flagged this later in the text. However, I would, like in such cases, I would advise, like the moment you notice that this inconsistency in terminology, and especially for a terminology that is for a term that is used so frequently throughout the entire text, I would advise that you add a comment right at the first instance of its occurrence. Um, Add a comment, flag it for the author, say that these one, two, three, four, however many terms have been used interchangeably throughout the text, and then you can either uh, explain why, depending on what you've decided to do with the inconsistency. If you were not sure what the author was meaning in was intending, like what their intended meaning was at each of these instances, then you would probably want to stay away from making a change, or like making a change throughout the text and then maybe just altering the author's meaning, so intended meaning. So in those cases you would ask the author to clarify. However, in case you're confident about the author meaning AD in all. So in this case, the I was quite confident that the author. I read through the entire manuscript. I kind of have the entire like context, and I know what the author is trying to convey through the manuscript. So I am quite confident that the author was using these three terms interchangeably, and they thought that they meant the same thing. So I have corrected most instances of the mention of eczema to AD because we've already defined it and we've already established what AD is. So I have revise this. So I would ideally add a comment here, flagging, and then flagging the inconsistency, and then mentioning what I have done to correct the inconsistency, and also politely asking the author to recheck my changes in case there's some issue. Okay, so now moving on. Uh, we then ed- we've edited this entire sentence for a little bit of clarity. You will also notice that a lot of the changes here are a little preferential. So it's that is all right because I just made changes according to like the tone that I like, the how I like presenting uh, academic papers. So that's fine. Many studies have evaluated the impact of AD according to its severity. Now, uh, in this case, the author had used according to the established severity. Now, is the use of the word established here does not really convey anything. There is they're not trying to say according to an established severity index because there is no that is not what they've done. That is not uh, what the rest of the manuscript conveys at all. So there was no risk of me having changed the intended meaning here. So I just omitted the word established and simply wrote according to its severity. And then we go on to say, however, the specific impact of the location of the AD lesions. Now, here, initially the sentence said the specific impact of the location of eczema on quality of life. So, this to me is slightly vague. I would say it is more specific and more accurate to say the location of the lesions of a disease rather than location of a disease, right? So you it is although it is okay to sometimes say location of cancer, it would be more appropriate to say location of a nodule or location of the tumor within the body, something like that, because it's just more specific. So that is how we've edited this sentence. Now we go back to. I'm sorry if this like is annoying a little because I'm switching back and forth from simple markup to all markup because I want to show you what the edited text looks like when it is not so cluttered with like track changes, while also showing you what changes have been made exactly. So now we move on to objective. In the present study, the original text said, I'm going to switch to. In the original text, it said that in the present study, we focus on the burden of disease caused by the involvement of atopic dermatitis on visible areas of the face and hands. Uh, so the changes that I made here was a changed focus on the burden of disease. Okay, very non-specific, doesn't need to be there. We can simply say assessed the burden of disease and be done with it. Uh, it is one less number of words, and then also just more precise, and assessed the burden of disease associated with. This is a preferential change caused by would have been okay as far as I can tell, but associated with is more uh, just sounds better to me. And then I've since we've already defined this abbreviation at the beginning of the rationale section, we eliminated this. Now, like I said, if you remember, I mentioned the biggest problem that I have with this document is with its methodology. So now, what the problem with the method here, the method section of this study is, I'm sure the authors did a great job with the methods, like how they conducted the study. The problem with uh, is with how they've presented it in the manuscript. A lot of the sentences say absolutely nothing and have no useful information, or like are so ambiguous that you'll just be confused as to what they've done. So this is the original text. The study mobilized for each. Sorry if I'm cringing a little bit. I it's fine. This study mobilized for each of the six countries where it was implemented. These are the six countries, targeting a representative sample according to the quota method of their population aged 18 years and over. QOL, which is quality of life, was assessed through the Quality of Life Index DLQI. So now let us look at the changes that have made, which is a lot. Um, so I simplify the sentences basically to say that the study included a representative sample of patients who were aged greater than 18 years, and I used the symbol instead of using greater than aged 18 years or over, which was the original phrasing here. And here, see, aged 18 years and over. That's a lot of words, unnecessary. So I use the symbol greater than equal to 18 years with AD from six countries, and I use an M dash. You'll see it better here. I use an M dash to basically uh, enclose this information, the number of the names of the countries that this study was conducted in, who were enrolled according to the quota method based on age, sex, geographic location, and income level. Now, this text, this piece of information about what criteria were taken into account while selecting this representative sample, this this piece of information was lifted from the method section in the main text. So I brought it in from there because otherwise this the method section here in the abstract was not really conveying much. I still have issues with this phrasing, but we will come to that uh, later in the text because also something I forgot to mention is that you will be able to see the comments here, and I have spoken about every issue that the text that we are going through has, and there is like explanation of why, what the issue is and what the author needs to do and what we need to do as an editor. So there is there are like instances like this where I've added a comment prompting the editor to add a comment for the author, flagging this. Now, the second part of the methodology section says quality of life was assessed using the QOL index, and then it was abbreviated to DLQI. Now, a very brief foray into like Google and Google Scholar showed me that DLQI is short for Dermatology Life Quality Index, which is a very established quality of life assessment index in dermatology. So I have revised that, and then would I would advise adding a comment asking the author if to confirm if this is what they meant, and if not, then they need to clarify what they meant so that we can revise it accordingly. Now, moving on to the result section. Then the result section is very simple, straightforward, not much wrong with it. It is phrased also, like phrased better than any other section in this abstract. So I'm not going to go through the result section right now. However, I will come back to it after we go into the discussion a little bit, and I will there's just one point that I want to make. Now the discussion section, right? The original discussion section was this much, and it said the degradation of quality of life by AD is maximal when the hands and the face are affected simultaneously. The impact is also significantly higher when the hands are exclusively affected compared to the face in brackets. The impact of QOL is strongly. Okay, let's unpack the first two sentences. The first thing that you would notice is that these first two sentences have actually you don't notice because we didn't go through the results. But the first thing that I noticed with the first two sentences is that they have nothing to do with the results that are mentioned in the abstract section. So the results only talk about quality of life, like specific quality of life parameters like stigmata, if they had like a sense of discouragement, and how like the significance of these results. However, the discussion section goes on to talk about how the quality of life is affected more when the quality of life is affected more when only the hands are affected as compared to when in cases when only the face is affected. This does not derive directly from any of the results mentioned in the results section. I checked, the main results section does have data to support this conclusion. However, the abstract itself does not. So this is another takeaway point for this abstract. For in general abstract writing, abstracts are need to be self-sufficient capsules of information. So have you cannot have concluding remarks of completely unrelated data, where like data that has not been presented in the abstract itself. So it needs to be a complete story all by itself, because a lot of the times only the abstract is available to view in a lot of journals. So after the paper is published, so we need everything to be self-sufficient, like this section to be self-sufficient. Now the way to correct that is to add a comment for the author flagging this issue and asking them to either add this data to the results section, or omitting these concluding remarks from the discussion section and rather focusing on concluding remarks that derive directly from the results that they've mentioned in the abstract section. Now, the other alternative to flagging this through a comment would be to correct this yourself. However, this can only be done if the content is readily available to you from the main text, which was partly true for this manuscript, which is why I have left it alone. And I for this manuscript particularly, I would have just flagged it because um, it this although um, these two conclusions are supported by data. It's just shown in a table, and there's no direct text related to this data that I could have lifted from the main text and put it in the abstract section. So I would have just flagged this in this case. Now, moving on to the next part, I'm not going to talk about the middle bit there in the interest of time. Um, Now, if you see the stricken out text, wait, I will go with you. This is the text that I have deleted from the discussion section. Let's read what it says. It says, surprisingly, exclusive hand involvement caused a higher impact in QOL than exclusive face involvement. Simultaneous involvement of the face and the hands greatly amplifies the deterioration of QOL. Now you notice that this is the exact repetition of whatever they've talked about in the first two sections of the same paragraph, which is why I needed to delete it because redundant. Again, we will need to add a comment flagging this for the author and explaining why we had to do it. Now we finally make it to the made it to the introduction section. There are about like two or three points that I want to make here. Now, The introduction section starts with atopic dermatitis in adults is often underestimated or excessively trivialized. And then it moves on to say, in France, a study found the prevalence of AD to be blah, and in United States, the prevalence to be something. Now, the problem with this part of the introduction is that it does not lay any basis as to why we are getting into this anyway. Like they talk about France and United States. However, they don't talk about like the worldwide prevalence. Like I mentioned, this is necessary information, and in this case, it would also have been sufficient. However, it has not been mentioned here. So, adding a comment where I would have recommended the author to include a short introduction about AD itself before moving on to its prevalence in different countries. So, what is the disease? What are its phenotypes? Where do the lesions occur most commonly? And what is WHO's take on this? Because I mentioned WHO because they have mentioned WHO later in the second part of the introduction section. So, uh, just prevalence data from WHO about AD would have sufficed here. Um, then this is a huge gap in how the introduction is presented. So we would have flagged that. Then uh, this is something. This is the original text. Sorry. So, since 2010, the notion of burden has been introduced by the World Health Organization in the evaluation of the care and management of chronic diseases, including chronic skin conditions. This sentence is very wordy for my liking. So, I edited it to the sentence was in passive voice. So, this notion has been introduced by WHO. We just flipped it around, made it active. Sorry, sorry. In 2010, the World Health Organization introduced the concept of burden in the evaluation and care and management of chronic diseases, including chronic skin conditions. So we've just flipped the sentence around just a little bit, but it has already reduced so many words, unnecessary words. Didn't need them, but so we edited them. Now, again, uh, after the so basically this part of the text that you see that has been deleted, it has not actually been completely deleted. I just rearranged the text. This part has been moved here. So this part is that first bit from the abstract section which we already read through, where we talk about atopic dermatitis and how it causes major skin lesions and the impact that it has on quality of life. So this introduction bit has been moved after the WHO bit because it just flowed better after us having introduced the concept of burden, that WHO has introduced the concept of burden when speaking of how chronic skin diseases affect a patient's life, and then moving on to talking about how AD in particular causes and a very serious detrimental impact on the patient's life. So this flows better instead of us going on to then talk about another study before even talking about how AD in particular has that impact. Then we move on to the main part, like the main the meat of an introduction section in any document. So, and that is establishing the gap in literature, one, and then establishing the objective of this particular study. So now in this document, in this manuscript, the authors mention they use the same exact sentences from the abstract that we saw, where they talked about that many studies have evaluated the impact of AD according to the severity of AD. However, there is no study that has investigated the impact of AD on quality of life of these patients. However, although this again the same thing that I mentioned for the abstract, although this does establish the gap in literature that the authors have intended to address through this study, it does not establish why we are doing this. Why are we studying uh, the impact of a specific disease on the quality of life of patients having this disease? Like, how will it inform future research? What impact are we uh, anticipating from it? So this comment basically sums up my thoughts on this. So the gap in knowledge has been established in this part of the text. However, the authors don't specify why filling this gap in research is necessary. Perhaps the authors want to mention that elucidating the impact of the location of the AD lesions on quality of life could in turn help formalize strategies to mitigate this impact. For example, labor related policy could be modified to prevent discrimination against an employee with eczema lesions on visible areas of the body, such as hand or face. Um, so, this kind of derives from the previous section, wherein they talk about how uh, patients with AD are discriminated against in workplaces. Okay, so this is we are through the introduction section. Now we are moving on to the method section, and this is something that I'm a little more excited to do because we are going to rearrange this part of the text live, right? Um, so this I'm not going to go through this first paragraph again because this is the exact text that was mentioned in the methodology section of the abstract. So we've already gone through why we've made these changes and the basic like gaps in information that need to be filled here. However, in the main text method section, we would need more details from the author about the exclusion criteria, inclusion criteria, all of that. So although this section has been edited for language and now flows a little bit better, there is a lot of important information missing here. So this has been flagged through a comment, and for this is for an editor. So comment for the author flagging the lack of precise details regarding the inclusion exclusion criteria, as like also they have mentioned a quota method. However, there is no description of what this method entails, what the criteria involved for this method are, nothing. So you would also have to add a comment either to asking the author to either mention add a brief description of what this method is, of selecting a representative sample from such a large population. I say large population because they are surveying 6 different countries, and then either that or they could have simply added a citation for a study or a paper that talks about this selection method in a in like in a very elaborate manner. So a citation would work or a brief description would work. Anything. However, the authors here don't talk about any of that. So an author, a comment flagging this would be essential here. Now, moving on to the second paragraph and the third paragraph, which we are going to rearrange now. So after having talked about I'm going to switch. This study included a representative sample of patients aged greater than 18 years with AD from 6 countries who were enrolled according to the quota method based on blood. Right now, this is what we have so far to go on. Now they suddenly move on to responders. They say responders were asked if they had a history of a skin disease in the past 12 months. For this analysis, patients who reported as having AD, confirmed by a health professional as the only skin disease in the past 12 months, were enrolled. This is the second paragraph of the method section. Now, the third one says, after approval from the national. So, okay, uh, we'll halt it first. The first thing that stands out is the use of the word responders. Now, the term responders typically points to a survey having been conducted. However, there is no mention of a survey before the word responders is mentioned, right? So, this is your first flag for this section. There is no mention of a survey. However, the authors seem to talk about some survey that went on where there were responders and they were asked about their history of a skin disease. So, having that in mind, you go on to the next paragraph, and wherein they say, after the approval from the National Patient Associations, participants were invited to complete a structured and consolidated digital questionnaire. You got the survey. This is the survey that they were talking about. However, they mentioned it after uh, they've already mentioned what the questions were about before even talking about what the survey was about. Those who confirmed the presence of eczema were asked to specify the lesion locations, so hands, face, body, and self-assessed the lesion severity. So the responders or the patients, they self-assess the severity of the lesions. Only those individuals reporting eczema as the only skin disease they had were included in the analysis. Now, two things. The first section here is clearly something that needs to come before the mention of responders here. And two, only those individuals reporting eczema as the only skin disease as the only skin disease they had were included in the analysis is a direct repetition of what was said in the previous paragraph. So for this analysis, patients who reported as having AD as the only skin disease in the past 12 months were enrolled. So this sentence, right? So you can keep only one of these sentences. So there are 2 points of rearrangement of this text. I will switch to all marker. Now the best way to make rearrangements or make drastic changes in like content or the structure of a manuscript is to switch tracks off, so that the so when you move the text you will when you move the text and place it in a new spot, the entire text will not come up as track changes. The authors will still be able to see the specific changes, the language related specific changes that you made to that particular text, right? So now I want to move this first sentence up to here firstly. So see, I moved it, and I can still see the change, the specific language related change that I made here. Uh, Hold on, just a second. Copy this up, cut. And then I will switch tracks back on and delete this part. So then there's a track change indicating that the sentence has been deleted from here. However, it has been moved here, and the language related changes are intact. And I will also add a comment flagging this, that this part has been moved from this section, right? Now, the second point of change is that this this sentence is a clear repetition of this. So I will first confirm that I have all sufficient information here. Were invited to complete a structured consolidated digital questionnaire. Responders were asked about this, and these were the patients who were included. those who confirmed. I am merging these two paragraphs because they talk about the same survey. Those who confirmed the presence of eczema were asked to specify the lesion locations. So we have all the information that we needed from this survey, so we can then delete this part of the sentence. And we have now a small paragraph that is sufficient and necessary all by itself and does not need any added information, at least when as far as it comes to the this part of the text, this part of the information. So this survey and what they were asked and what they um, like what the selection criteria is. However, there is one gap. You will notice that the patients were asked to self assess the severity of their disease. Uh, yeah, here. So they were asked to self assess the lesion severity. Now, I would ideally add a comment here asking the author what parameters did they give the patients, like what how did they assess the severity? Was there an index used, some established dermatological index, some like for pain you could use a visual analog scale, something like that. Was something like that used? I would add a comment here asking comment for the author, asking him to specify the parameters used to assess, right? The other thing that they missed was confirmed by a health professional. However, no mention of how this was confirmed. So, was like some specific test used, um, some parameter. So, again, talking about preciseness in scientific communication, this needs to be precise here. Uh, Currently, it's quite vague and doesn't really give you the most necessary information. Uh, then we move on to, we are not going to dive into this part of the text. It's just been edited for great, like better flow of the information. They talk about the DLQI basically, and talk about like how it is rated out of 30, and what different uh, like slabs of score mean, like in terms of severity of the impact of AD on quality of life. So 6 shows low impact, uh, greater than 20 shows extremely significant impact on quality of life and all that. Now, moving on to the statistical analysis section of the methods. Uh, this part is fine. They talk about how categorical values are expressed as numbers and percentages and all of that, and the tests that were used to uh, conduct the comparisons. And then they go on to talk about the uh, statistical software that they use to compute all the data. Um, Now there are two gaps here. One is mentioned here, um, that we don't the authors have not mentioned the manufacturer details for the software that they use. Second, and the most important one here, is that there is no mention of a power analysis having been conducted. So how did they decide on how many patients that were enough to have like a sufficient amount of power, uh, and to like to detect significance in the data here? So a power analysis is very important, and I would have ideally added a comment for the author mentioning, asking, asking if they had conducted power analysis, and if they could add information related. Hmm. Yes. Now I just so this is basically done. I just wanted to go through the methods and up until the method section for this session. However, I will go through the comments again, like the comments here that I'd added, just to make sure that I've talked, like I've covered all the points that I wanted to cover. And I'm really really sorry about my coughing. I have a really bad throat. This is a comparison error. I just added comments about like some common language issues, which we didn't go into today in the interest of time. But do let me know in the Q&A section of this session, and I will uh, explain this in case you want to an explanation of what a comparison error is and how it was applicable here. Let me know if you have any questions. Uh, I take it there are no questions. Uh, all right. Okay. So if there are no questions, we can uh, if there are no questions, we can, I think, close this session. I am really happy that we got to do this. I like I mentioned before, I this was my first time doing this. Any feedback, any questions, any suggestions would be very welcome. I would really like those. Please do fill in the feedback form so that we can like improve and do better next time in case that's something. Okay, so okay, thank you so much for being here. Thank you so much for bearing with my cough and my bad throat and my rambling. Uh, thank you. Okay, bye. It's really nice.